Guyana's first ever Health Expo opened on May 30, and for the first time, the general public was given the opportunity to interface with personnel from the Ministry of Public Health over 3 days. President David Granger, speaking at the opening ceremony, said public health services are intended to be delivered at 3 levels of society: the national, regional, and neighborhood. The objective of all 3 levels is to provide access to health services based on quality, reliability, and inclusivity.
President David Granger said that if Guyana is to achieve the objectives set out in the United Nations Sustainable Development Goal No. 3, our national health strategy's 3 priorities must be projected.
Guyana is committed to the objective of a better life with good health, an objective that is in accordance with Sustainable Development Goal No. 3, as you've heard before, of the 2030 Agenda for Sustainable Development, healthy lives and human well-being.
The priorities of the National Health Strategy, titled Health Vision 2020, include universal access to public health coverage, universal primary and preventative health care.
Preventive health care is central to universal public health coverage, to primary health care and the delivery of public health services. No public health system and no national health strategy would be complete or successful without emphasizing the importance of preventive care. In Guyana, therefore, prevention is at the center of our national health strategy. It is a principle of the public health interventions and one of the principal means to improve citizens' mental, physical, and social well-being. But where does prevention start? It starts with you. It starts with mommy and daddy. It starts at the home.
Minister of Public Health, Walter Lawrence, said the event's vision is charged towards resetting the public's approach to their health.
But if we feel ill, we rely quite often on the home remedies, on the bush medicines, the drugstore for a quick fix. We try every conceivable potion we can put our hands on, our last option being the doctor, which sometimes turn out to be detrimental, even fatal in some instances. Now, ladies and gentlemen, Guyana can ill afford an unhealthy nation, much more a nation with a mindset such as I have depicted. Guyana is poised for great things, but in order for us to be sustainable as a nation, the underlying and key component is wellness.
She called for a change in the way citizens embrace and manage their health needs.
We want to move from the almost laissez-faire attitude to the point where it becomes top priority. This means that your visit to the hospital, clinic, or center will not be relegated to the back burner. Your regular health checkup will assume the same position on your agenda as your appointment to have some extracurricular activities.
The Ministry of Public Health's Permanent Secretary, Colette Adams, said the Expo's theme is best suited given the ministry's remit as one of the most essential social sectors. Despite the many challenges facing healthcare providers, the Permanent Secretary expressed optimism that these will be overcome in the near future.
Guyana will continue to reach for higher goals in the health sector. On this note, Health Expo 2018 is expected to strengthen health communication and awareness among citizens, sensitize the public about the services provided by the Ministry for improved health and care, and to provide a platform where local and foreign manufacturers, distributors, and suppliers can interact and discuss current knowledge and best practices for Guyana.
The opening ceremony featured cultural presentations such as a Chinese dragon dance and a performance by saxophonist Roy Stewart. Following the ceremonial cutting of the ribbon, President David Granger, Prime Minister Moses Nagamutu, his wife Sita Nagamutu, Public Health Minister Walter Lawrence, and other ministers visited the booths on display. Speaking at the launching of the Health Expo on April 18, Prime Minister Moses Nagamutu underscored that despite the challenges faced by simultaneous sectors for financial backing, Guyana has been able to maintain a relatively impressive healthcare system.
Our country is fortunate in that we have a health system that is centrally driven, a health system that is rooted in concern and care for our people. This has nothing to do with whether it is this government or that government. It has to do with a national policy that we have seen in this country since independence.
The Prime Minister also highlighted the importance of making healthy choices in order to live happy and full lives.
A nation is blessed if it has healthy and productive citizens who become useful in all spheres of their endeavors, in all things that you want to do. And the health fair, as I understand it, is to be able to promote awareness about health conditions, diseases, viruses, things that could affect this wealth of the nation, our health, our good health. It is to be able to explain what are the available services, whether it is prevention medicine, whether it is maternal care, whether it is for therapy, whatever services, education in areas particularly dealing with young people.
Over the period, the Expo is expected to attract hundreds from across the country, including school students, with the overall intention of bringing health information and awareness to the public. The Health Expo saw a collaboration of private sector agencies along with international support bodies to make the event possible.
One of the Expo's highlights was the launch of the Mental Health Substance Misuse Prevention Program and the revised dietary guidelines. MHU's Health Education Officer, Tashia James.
We're going to launch it by having our giant-size adverts, as you can see behind here, and also we're going to be giving information. And more importantly, we will have interactive workshop on site with students and the general populace. We're starting with the school children, the young adults, because we find that they're the segment of society that's most at risk with substance misuse.
The Food Policy Unit's Director, Dinte Conway, said that much focus will be placed on the 9 guidelines.
These guidelines we have 9 guidelines, and they're simple messages for anybody to adapt for a healthy lifestyle. Healthy eating, know or limit your alcohol intake, and physical activity.
The Vector Control Services also made their presence felt.
Welcome to the Neglected Infectious Diseases booth. We are part of the Vector Control, and our unit focuses on 4 major diseases. We have the leishmaniasis, lymphatic filariasis, known as filaria. We have Chagas, and we have soil-transmitted helminths. Now, most of you may know about filaria because we're having the Mass Drug Administration campaign ongoing. But what person do not know is about the other 3 diseases that we also manage. And one of the reasons why we're focusing on these 4 diseases, because as the name said, neglected. People do not pay attention to it. So our hope is to raise awareness so persons can know what these diseases are and to know that they are prevalent in Guyana, what they can do to prevent, control, and eliminate these diseases. So at our booth today, we have posters in relation to filaria and Mass Drug Administration campaign. We also have a flyer that you can use as a takeaway information, as in the basic points, key points you need to remember in relation to that. We have brochures in relation to leishmaniasis. That is commonly known as Boschias. Most persons don't know about that because what you find is that most of the persons who are infected are from the hinterland region. Okay? So to the coastlanders, this might be something new to you. But you need to know about it because from time to time we frequent the hinterland region because that's where the beauty of Guyana lies. So we have a brochure that they can take away to learn more about leishmaniasis and the various presentations it has. It don't have one face, it has many faces. And we need to know because it's curable, right? It's curable. Some of the lesions can cure spontaneously over a prolonged period, but most of them generally require specific treatment, and we have it available in Guyana. And that's that's also one of the key points that I want to get out there. The medication we have available at our service is injection meglumine antimoniate. It's commonly known as glucontine, and it's free of cost. And for you to know that it's the worldwide, that is the first line treatment for these diseases. So you don't have to go over the borders to our neighboring countries because you're thinking that they have the best treatment. No, we have the first line treatment available to you, and we want the public to benefit from it. And also what we have, because we were having school children coming around on Friday, we have them visiting our booth, so we have a few attractions for them. We have the games where they can spin, they can answer a question, and once they answer correctly, they can win a prize. And even if they don't answer correctly, then we will educate them and then they will learn something new as a takeaway.
The Men's Health Unit also hosted a mini workshop series called What Men Need to Know. Approximately 135 booths were on show and free health services were available to the general public.
KMP Diagnostic Center was formed or created because we realized that there is not a health crisis, and we are the solution for that. Health is something not to be taken lightly or for granted, so we created this company so that we can meet everyone's needs and financial situation. We want to raise awareness that we're here not to take away anything from anybody, but we're here to supply, sell, and let the public know that we're in it not for the money or for anything else, but because we care about our country's wellness and about going forward.
INCAD Medical and Laboratory. It has been many years in the market. We specialize most in imaging equipment, all the equipment for hospitals and laboratories. We also supply consumables, reagents, parts, or strong technical support. We have a team of engineers for most brands. We don't sell only the equipment, we sell also the equipment and support. That is very important. We try to open market in Guyana. We had big expectation in this country. That's why we partnership with the KMP Project Management. We hope we can support all the medical market in the country.
And I am from the Phoenix Recovery Project. And that is a rehabilitation center which is located in Monrepo on the east coast of Demerara. Oh, this program is a program for people who has a problem with substance abuse. It's a rehabilitation center for addicts who are sick and suffering on the streets. We offer them help. Now we're having a treatment center, and the center is from 6 months to 9 months, 9 months to a year. That depends on the clientele. But recovery works, right? We help people to get back into society and live a normal life.
Well, we are out here to demonstrate and to show the public what we do at the Tulmiri Rehabilitation Center. It is so nice to come out here that we can educate persons of the service that we provided at the center.
These are the treatment of traditional Chinese medicine, and we also provide a traditional Chinese medicine service in Guyana.
I feel very good. We should have had this a long time ago, but there's always a first time, and I do hope that they can have it again next year.
The inaugural Health Expo's team, Reaching for a Better Life with Good Health, is a reminder that there is a definite connection between good health and a good life. You have been watching InfoHub Extended. Do join us again. Goodbye.